everyone, today is Memorial Day and tomorrow will be 11 weeks since I had my jaw surgery, and so I kind of wanted to give you an update as how I feel now, but I also wanted to give you an overview of how I felt from the beginning of surgery until now, because with my mouth being closed shut, you can see how I looked, but you can't really understand what I'm saying, or I couldn't give you a very good description of how I was feeling at that time. So I'm kind of going to go back over that, and then I'll tell you how things have been from the beginning of surgery until now. So when I was in PACU, I had pain right when I woke up of a 7 out of 10, and my nurse gave me pain meds. She gave me IV fentanyl, and then she also gave me a little while later some oxycodone, liquid oxycodone orally, because I couldn't swallow any pills. So I was taken up to my room, and from the time I got to my room, the most pain I ever had was a 4 out of 10, and I only took Tylenol and IV Toradol, which is like an anti-inflammatory medication. I only took that while I was in the hospital, and then once I came home, I only took ibuprofen maybe once a day if my swelling was kind of bad, trying to get that down, but my pain really wasn't bad for the surgery at all. I would say my rhinoplasty was definitely more painful, and I told my surgeon who did my rhinoplasty that, and she was really surprised. So the worst part of the jaw surgery was not being able to eat for 10 days. I mean, I could have liquids, but I felt like I was dying, and I was losing a pound a day, so basically I felt like I was starving. As for nausea, I did not have bad nausea the first day out of surgery, but the second, third, fourth, and fifth day, I was pretty nauseous, and the third day was the worst. I was so nauseous I didn't even think I could eat or take my meds. So my mother-in-law was over, and she was taking care of me for the day, and she went and got me ginger ale and Coca-Cola, and those two things really helped my nausea, and I basically had ginger ale or Coca-Cola before I had any other type of food for the first 10 days, because it settled my stomach, and sometimes I would just have that because it was calories, even though it was empty calories. It was something, and I was so hungry, and it helped my stomach not be upset. So I drank a lot of those things my first 10 days. I was very hungry, and after about the third, or I'd say fourth or fifth day, I would cry every night when Ken was home and he's eating dinner, and I have to have tomato soup again. And I really got upset because I think you have to put the straw back into this space behind your molar, and that's how the food gets through. And I think that area got swollen, and so sometimes I couldn't get the food through there, and it would just come out and drool down my face, and so I couldn't even eat the couple things that I wanted to eat. I couldn't even eat because I had a hard time even getting it back through that area. Sorry, there's a spider. So that's why I was really upset, because the things I was able to eat or drink, I couldn't even drink. And then there's a video of me, which I'll show you. I tried to blend bread and butter because I really wanted it, and anything that had chunks would get stuck in the straw. So I would try and push it through, and sometimes it would just explode in my mouth, or it would just clog the straw and I couldn't get anything through. So that was really frustrating, and there's a video of me crying because I was just so hungry. And even though we just have one video of it, I probably cried at least every other night. On the 7th day, I have these buttons in my mouth for my orthodontic work that they left in there. They're like little metal buttons on the inside of my teeth. And the one was really scraping at my tongue, so I went to my orthodontist, because they're a lot closer than my surgeon, to see if he could do anything to take it out. And when I saw him, I couldn't open my mouth wide enough because the muscles were tight from surgery for him to get in there, but he was able to contact my surgeon, and he was able to later that night cut my bands, which is the first time they had been cut since surgery. And he wasn't able to get that button out, but I was able to take my bands on and off at that point. And when I came home, I just kept rinsing my mouth, because you have this, from the day of surgery, the minute you come out of surgery, you have this horrible taste in your mouth. It's just horrible. And it's not just even a normal bad breath. It's like, I don't even know how to describe it. It's a very distinct smell, and my nurse practitioner even said that it's a very distinct smell. I don't know if it's maybe the antiseptic they use in surgery or what, but it's really gross. And I took a bunch of water and chlorhexidine, which is the special mouthwash that you use after surgery. And I just took my syringe and I rinsed and rinsed and rinsed my mouth. And I had pieces that came out that looked like meat almost, or I don't know, it's really gross. One of my buttons had fallen out, and it was just really gross. So so that button, though, that was still in there didn't bother me after I was able to take my bands on and off and clean in there a little bit better. So I still had to wear my bands basically all the time except for to brush. I didn't even open it to eat, because it really didn't help having my mouth open to eat, because I couldn't close my lips around the straw because I was still so swollen. So it was a little helpful just for cleaning purposes, and the smell, even though it wasn't as bad, it did not really go away until I got my splint out at 6 weeks. So it's kind of gross. So at 10 days, I was so hungry and so miserable, and I had lost 10 pounds after 10 days. I was losing a pound a day. My nurse practitioner got me in, and she took out my splint, which I will insert that video here so you can see. No, she didn't take out my splint, sorry. She took off my bands and gave me a lot lighter one so I could actually talk. And just being able to eat soft foods, it really made a huge difference. So overall, I would say that first 10 days was really horrible. I hate to say that, and I hate to scare anyone, but it was really difficult. Just not being able to eat, and I had a split in my mouth, and I couldn't even open for the first 7 days at all, so I was really nervous that I was going to throw up in my, I wouldn't be able to open my mouth. We had to keep emergency scissors next to the couch. I was sleeping in the living room, and we kept a pair in the bathroom, and Ken slept on the couch with me because we were really nervous that I would throw up or cough and choke on the phlegm I had, because after you're intubated you have phlegm, and it was kind of scary. But once I got past the nausea, it wasn't as bad. Yeah, first 10 days were very difficult. Then I'll make a separate video for weeks 1.5 to 6 weeks. But yeah, first 10 days were really difficult. Obviously nothing unbearable. I made it through, but I do not know if I could have gone the extra 4 days with my mouth completely closed, not being able to talk. I love to talk, so you can ask him. That was really hard for me, and I think he was really annoyed, because when I couldn't talk and I wanted his attention to write on my whiteboard, I would just go like this to get his attention, and I'm sure that got really annoying. I found this app on my phone, not an app, it was just a website, and I just put in text to talk into Google, and once I found that on day 4 or 5, it made my life so much easier, because I could just type in what I wanted to say and press the button and it would talk it out. And I think Ken really appreciated that, because I think he was really tired of having to look at my whiteboard all the time and me clapping for him. Or sometimes I'd go, So yeah, that really helped me a lot.
We're getting undressed. Nice boots.
Thanks. I said, I don't mind poking you, but man, I hate to do that.
Isn't it funny though?
Yeah.
How you feeling? cheeks hurt? Here she is. How you feeling? 1 to 5. 4. What about pain? 2 out of 10. Well, that's good. Surgery went quick. 1 hour. She can't talk. Has to use all this stuff to suck the blood out. It's 4 liquids. We'll check back in a little bit. Walking. Hello. How you feeling? So? Hungry? Let's see. Turn to your left. You look like a hamster with stuffing up for the winter. Turn to your right. Your lips and her chin are numb. Can't feel it. Her jaw. It's pretty funny too. All over her shirt. Well, this is day 3. Today's Thursday. Surgery was Tuesday. Post-op day 2. Okay. I'll check back tomorrow. Hi. Day 3. Post-op. A lot of bruising. A lot of bruising in the neck. That side not as bad. This side's pretty bad. Does not feel good. No vomiting. A little nauseous. Stops at stomach. Lack of appetite. Got her a smoothie. Bye. He misses his mama. A lot of oxygen in this house without mama talking, huh? What are we gonna do with all this? Okay, bye. Hi. One week, babe. Turn around. We're 1 week. She's up and walking. She's smiling. Not feeling us down. What? She's not sad. Bruising? Ooh, there we go. Not too bad. 1 week to go. Let's go, buddies. I'm not doing a picture. Bread. Butter. Milk. Okay. Meanwhile, burger. Sniff test. It smells like bread. Oh, down the hatch. Alright. Let's try liquid bread, milk, butter, and black bean soup. She's drinking it. Kind of chunky. Tolerable though? You swallow it? The bread? Surprise. Day 9? Day 9, next follow-up appointment on Tuesday, hopefully to get these bands loose. Drinking some tomato soup. Not her favorite meal, but that'll fill you up. Do you have anything to say? Kidding.
So I just saw a new practitioner. She let me see her 4 days early. So she loosened my bands, so I can talk a little now. But I still have to wear the splint and a couple of rubber bands for another 4 weeks. So now I can talk though, which is amazing. And she said that I can take my bands off to eat and brush my teeth. So I am going to go get a mashed potato bowl without chicken and some mac and cheese from KFC. It's my favorite. So yeah, my teeth. Today is the time post-op. When I woke up this morning, I had a lot of, well, not a lot, I had some pain in my jaws and in my teeth, but I took like half a dose of ibuprofen and I had some ice on it, and it went away. It usually just hurts in the morning after I've been sleeping, but she said mostly things look good. I do have a little opening right over here on my incision. She said I had a lot of drainage. She said that's pretty common, so she just put me on some antibiotics. So I gotta go pick those up. So yeah, so this is numb here. I haven't really been able to tell you. Like right here on my lip, it's not, well, it's numb, but I can feel a little. So when I like drool, I couldn't actually feel it on there. It kind of feels cold. So the feeling is coming back. I get little like tingles in my lip and in my chin, like when there's a nerve is trying to like work again. So yeah, I was super excited when Ken called and told me today that I could come in and get my bands loosened because oh my gosh, it's so much better. Oh, it's so much better. You could cry. Oh, yeah. So I'm gonna keep vlogging more now that I can actually talk. I know Ken has taken some videos for me, but it was just too hard to try and vlog when I couldn't even talk. So anyway, I will catch up with you maybe for my first food.
Well, I guess it's time for an update. 10 days later, rubber bands are loose.
I can open my mouth.
Mouth is open and KFC is on the counter.
KFC is on the counter. I gotta chop this up into small pieces so I can just swallow it. I can't chew anything.
But you don't have to blend it.
I don't have to blend it. And it'll go through, then it'll go through a straw. And I can talk. Although my jaws are tired.
That way. Mm-hmm. Nice.
I feel better today. I didn't take a nap today. I was out with my friend. We got our nails done.
And she didn't cry today either.
I didn't cry today or yesterday. And I got a new dress. 2 new dresses.
Nice. She's happy.
Mm-hmm.
You're happy, I'm happy. Tyson's happy.
I'm always happy.
Tyson.
So yeah, weeks 1.5 to 6 coming up next.